I'm sure everyone is here. Okay. So right now, I want to introduce Professor Susan. Yeah, we are delighted to have Professor Susan, who is currently the Department of Nursing undergraduate director at University of New Hampshire. 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 Okay. She has had extensive clinical work for more than 30 years, from 1975 to 2005, including critical care and peri-anesthesia, head nurse, clinical director, and management consultant of cardiovascular nursing and cardiosurgery service. And she has been a faculty member since 1989 and published at least 6 journal papers last year. She is a prolific scholar and a very friendly person. We are very grateful to Professor Susan for sharing her expertise. So today's topic is what? Yeah, nursing and healthcare in the United States. And I think Susan, she can share with us many experience and introduce you the concept in U.S. Healthcare. So please give warm round and applause to welcome the distinguished Professor Susan.
Thank you. Thank you.
Thank you.
So my English is like a 2-year-old, right? If you're 2 years old, how much Chinese do you know? My Chinese is like a 2-year-old. You know, hello, goodbye, how. And my favorite word is 为什么? Okay? So your English is much better than my Chinese. Okay? So don't be afraid to use your English. Or we have wonderful translators. Okay. So how many of you have been in the U.S.? Anybody? No? Oh, you are most welcome to come to the U.S. This is my 25th year in Taiwan. I have come to Taiwan 25 years. Okay. So I've traveled all around, and I'm very excited about a holiday tomorrow. Right? Where is everybody going on holiday? You all going home? Yes? Well, I'm going down to Tennessee tomorrow. It's going to be very hot. Very hot. Okay? So, with that, let's talk about the U.S. So, I live right up there. See that little state there? That's New Hampshire. That's where I live. Right now, it's very cold. Very, very cold. Okay? We had a lot of snow this winter also, so it was quite cold. So my husband is at home shoveling snow and taking care of 2 dogs. So I have the fun part. So let's look at U.S. healthcare a little bit. I'm going to compare it to Taiwan healthcare. So we spend a lot of money in the U.S. on our healthcare. About $3.5 million in 2018 was spent on healthcare. And that is a large part of our gross domestic product. Now, gross domestic product means how much does your country produce? How much money does your country produce? And GNP is an indicator of how you spend your money. And we spend probably at least 20%, 16.9 now, 20% of our money that we make as a country on healthcare. Now, of that amount of money, we spend 33% as a nation on our health care in hospitals. 20% goes to physicians and 10% goes to drugs, and the rest is spread out. Now, if I was to ask you how much does Taiwan, what percentage of Taiwan spends for hospital care, that would be a lot bigger. I'm going to tell you that people in the U.S. do not like to go to the hospital. People in Taiwan like to go to the hospital, right? They love to go to the hospital, which is why the emergency room is full of patients forever and ever and ever, right? Well, we have problems in our emergency room too, but it's not with patients that are not really, really sick. Okay? So we don't spend a lot on hospitals. So where does our money go? Well, here's the 33 that's in the hospital, 20% for doctors, 10% for drugs, and then we spend money on other types of care. And we spend money on nursing facilities. And we spend money on dental, home health, physical therapists, and other occupational therapists. And DME stands for durable medical equipment. It's like those walkers that you usually use. That's what we spend money on also. We have to buy that stuff. All right, now who pays for our health care? And this is where it's very, very different from Taiwan. In the U.S., you have private insurance. And that comes through where you are working, through your employer. So your employer helps you pay for your insurance, but you also have to pay for it. Okay? So the employer puts in some money and you put in your money when you're working. Now, 6% of people pay for their own private insurance. Pay for their own private insurance. But every insurance company requires you to make additional payments when you require services. So if I go to the doctor, I have to pay him out of my pocket some money, and then my insurance will pay for the rest. Okay? So everybody has what we call co-payments. You have to pay along with the insurance company. Now, that is called co-payments. Now, my insurance does not take effect until I reach a certain amount of money that I have already paid. Okay? So if I go to the hospital in January, I have to pay all of the price. And if my out-of-pocket deductible is $1,000, then the insurance company will pay anything over $1,000. Okay? Understand that concept? That's called out-of-pocket expenses. So I have both co-payments and out-of-pocket expenses. Now, public insurance is available, and 20% of the population in the U.S. rely on something called Medicaid. And those are the people below the poverty level. So if you are poor, the government will pay for your health insurance. 14% rely on Medicare, which also pays a hospital a fixed amount, regardless of treatment costs. So if you go to the hospital for surgery, let's say you need your appendix out, okay? You need your appendix out, and your surgery costs probably about $10,000 US. Medicare will pay $2,000. They don't care what the hospital charges. They'll pay $2,000. That's it. That's rough. Right? Now, 1% of the population in the U.S. is on military insurance. So if you're a veteran, if you've been in the Army, the Navy, the Air Force, Coast Guard, my husband is a veteran. He was in Vietnam and in the Army, and he goes to a veterans hospital. You have veterans hospitals here.
At Veterans Hospital.
Yeah, the 20 Kaohsiung.
Yeah.
Right.
Yeah.
Yeah. So we have Veterans Hospital, and that care is absolutely free. No matter what, the care is absolutely free. Okay? Now, retired or active. Active or retired. If you're in the Army or the Navy or the Coast Guard, you automatically get free care for life. Okay? Yeah, that's good. Huh? And you get free drugs. And you get free surgery. In that hospital. In that hospital. Okay? Now there is at least one hospital in 49 U.S. states. So we go back, there's one hospital in 49 states that does surgery. Except for my state. We have a hospital where they don't do surgery. So we have to travel, they have to travel to another hospital. Okay? In some states there are more than one hospital. Texas, because there's a lot of Army people here, there's a lot of hospitals. There's a lot of Army people out in Colorado and in Washington, and certainly around the Washington, the D.C. area. Yeah. So if you're a veteran, my husband never has to worry about health care. I have to worry about health care. I have to worry about how to pay for health care. Now, the problem is 7.6 of the people in the U.S. do not have insurance. So if they are sick, what do they do? What do they do? What do they do? What do you do? Go die? Waiting to die? Yeah? Let's say I break my arm and I don't have insurance. What do I do? Huh? I go to the hospital, right? Pharmacy will not give you medicine that you need. You have to have a prescription. Yeah. I will go to the emergency room, and by law, the hospital says we must give you care. No matter how much it costs, we have to give you care. So how does the hospital pay for that? How do they afford that? You know, you're the hospital, right? You're the hospital boss, big boss here, big boss, okay? I have a broken arm. You're gonna let me come to your hospital? Yeah. Right? How are you gonna make sure that you can pay for my broken arm? So she comes to the hospital, she's got a broken leg, right? You got a broken leg. She has insurance. Yeah, you're going to charge her more. You're going to charge her more. You're going to charge her for part of my arm. Not fair. But is it fair that I don't have a job and I can't get insurance? Not fair. So there's a lot of moving around of money by hospitals. But let's say she never comes with her leg that's broken. What happens to your budget? You start losing money, right? Lose money, lose money. You're going to pay your nurses? No. You're going to pay your electric bill? No. You're going to go out of business. Right. And in the U.S. now, a lot of very small hospitals are having to close because these people need care, but they don't have insurance. That's a problem. All right.
So the hospital is not getting money from welfare.
Hospital is a business. In the U.S., hospital is a business. Hospital is a business. Government doesn't care. You don't run your business very good? She's not a very good business person? Too bad. Too bad. Yeah. The only government-run hospitals are the veterans hospitals. Yeah. There are some psychiatric hospitals, but not many. The government owns. Right. All right, so Medicare is the largest payer in the U.S. of healthcare. So Medicare is an insurance program, okay? But it's run by the government. This is a government insurance. And they provide coverage for those over 65. Now, I have Medicare. Why? Because I've been working for 50 years. I'm really old, that's why I have like this. I've been working for 50 years, and every year, every week I get paid, I put money into Medicare. Okay? So I have helped Medicare with I give them Medicare a lot of money. And so when I turn 65, I can use that money for my health care. Okay? Now, providing I have worked during that time. Now, the problem is Medicare will not pay the whole bill. I got my broken arm, right? I go into her hospital and she says, "What kind of insurance do you have?" And I say, "I have Medicare." Medicare will only give her 80%. You spend $100, and Medicare gives you $80. Where do you get the rest of the money from? You got insurance? Oh, good. Good. Okay.
So how about if the patient dementia or schizophrenia, something like a mental health issue?
So what?
Also, what those can they go to the hospital? Or?
Well, we don't want them in the hospital. They're not really sick, right?
Yeah, yeah.
Yeah. What happens to them? And if I need drugs, it covers 80% of drug costs. Okay. So there's a lot of new drugs out there. Everybody know about all our new drugs for obesity, right? You know, there's a lot of drugs now in the U.S. for obesity. We've got Ozempic, and we've got a whole bunch of things. Take a drug, lose weight, right? They know? Yeah. Those drugs are over $1,000 a month. Right? Do you think Medicare is going to pay for that? No, they're not going to pay for that. Now, to make things even more confusing, there's 4 parts to Medicare. Part A covers hospitals. Part B covers doctors. Part D covers drugs. So every piece covers a different thing in a different way. All right, who provides the health care in the U.S.? So that's how we pay for it. Who gives us health care? Well, we have preventative care that's provided by primary care physicians, also known as PCPs. PCPs. And nurse practitioners. And the state health department. But the state health departments are not that active. They're mostly interested in global issues around the state. Right now we're having a problem with influenza in my state. But your state, you live in Massachusetts, right? You live in Massachusetts, which is my neighbor. Your health department may be more interested in narcotics. Okay? Your state may be more interested in HIV. So every state has their own health department, their own interests. All right. So once a year, I go see my PCP. Okay? Or maybe I go see my nurse practitioners. Now, nurse practitioners can have independent practice. They don't need a doctor. They can give you treatments, they can give you drugs, they can give you referrals, they can have their own office. And they do have their own business. So that's preventive. Primary care. So now I get the flu. I have to see my doctor because I get pneumonia and I have to have antibiotics. Okay? So I go to my doctor for primary care. I can go back to my PCP or I can go to my nurse practitioner. My nurse practitioner can give me antibiotics. If you're pregnant, you'll go to your obstetrician. Every year, a woman will go to a gynecologist. If you have a child, you go to a pediatrician. If you have to have your colonoscopy or GI problems, you go to your gastroenterologist. And of course, you go to your eye doctor to get checked. Right? So in the U.S., you may have 4 or 5 different providers of care. Okay? So my husband is really funny. He has to keep his calendar to see what doctor he has an appointment with this week. Because he's a diabetic, so he has a PCP, he has a diabetic doctor, he's got a veterans doctor, he's got spine problems, so he's got an orthopedic doctor, he's got prostate problems, so he's got a urologist, so he has many doctors for his care. Now, the thing that we have different from Taiwan is something called ambulatory care. Right? This is not a hospital. This is an ambulatory care facility. Ambulatory means what? What does ambulatory mean? If I'm ambulatory, what can I do? Look it up. Look up ambulatory. You've all got cell phones. You've all got Google. Look it up. What does ambulatory mean? What does that word mean? Ambulatory. Important word. What does it mean? Well, I'm mercy. What does ambulatory mean? I'm mercy. Ambulatory. What does that mean? The patient can walk. Right. So I can walk means I don't need an ambulance. I don't need a car. It means I can get a ride to here and I can walk in. But I'm still sick. Right? I'm still sick. The hospital, I can walk into a hospital, but it's not the ER. It's called urgent care. It's ambulatory. I walk in. So ambulatory care facilities are open from 8 a.m. to 8 p.m. Now, we have a lot of these. Why? Because remember what I said? People in the U.S., do they want to go to hospitals? Do they like to go to ambulatory care? Yes. Why? It's fast. No appointment. You can see a doctor or a nurse practitioner. You can get drugs. You can get lab tests. You don't have to stay in the ER for 48 hours. Right? Yeah. So last year I got bit by a spider on my arm. And it got red and red and red and red, right? That's an emergency. Yeah. What would you do if you had that in Taiwan? You call in, right? But you can walk, right? You still call in though. You go to the hospital, right? And how long would you wait for someone to look at your hand? And how long would it take before you got out? Couple hours? Yeah, right? And then all those people in the emergency room, they're real noisy, right? Yeah. Well, so I went after a bite on my arm. I walked in and said, I'm here to get antibiotics for my arm. Oh, right away. Took me right into a room. You're the nurse practitioner. You look at it. You say, yes, you need antibiotics. Here's your prescription. I walk out. 15 minutes. 15, 1-5. Cool, huh? Isn't that neat? Yeah. So my husband, a couple of years ago, had a UTI, right? Urinary tract infection. So he says, oh, he was sick. He had high fever. He had the chills. He had blood in his urine. He says, oh, I said, I need to take you somewhere. Where did I take him? To the emergency room? No, what time was it? It was 6 o'clock at night. Oh, they were open, right? I take him into ambulatory. He walked into ambulatory care. Walked up to the desk, said, can I help you? Yes. I have a urinary tract infection. Okay, no problem. Get him in, give us a urine sample, draw some blood, take his vital signs. You have a urinary tract infection. Yes, I know. Okay, well, we can put you in the hospital. And I said, no. Or we'll give you a shot here, give you antibiotics, and you go home and drink. Good idea, right? We were out of the ambulatory care within 45 minutes. 45 minutes. Next day, he was all better. Okay? So we have many, many ambulatory care facilities. But if it's after 8, so last year my husband was having palpitations. Palpitations, his heart. 8:50, right? 9 o'clock at night. Okay, we have to go to the ER. Right? Go into the ER, wait in the waiting room. 1 hour. Wait. Not big emergency. Take him in, sit him in the chair, wait 1 hour to see a doctor. Wait 1 hour to see a nurse. Right? Like 2 hours. Now it's EKG. Right? Lab work. Wait another hour. It took us 5 hours. And I knew there was nothing we could do about it. But that's the ER. So that's why U.S. people do not like to go to the ER. We love our ambulatory care facilities. Okay? They can put fractures, my broken heart, my broken arm, they can fix that. They can sew up lacerations. They do everything except chest pain. They don't do chest pain, right? Because that requires more diagnosis. Now, let's say I am acutely ill. I can go to ambulatory care, or we have public hospitals. But look at the average number of beds. How many beds over here in the hospital? So many, yeah. How many? How many? You should know this. How many beds? How many acute care beds are there? You know? Somebody look it up. How many beds in Kentucky Hospital? How many patients can they take care of? How many? Around 2,000? How many? 1,000? 1,500. 1,500. Our hospital averages 129. We've got small hospitals. Right? Why do we have small hospitals? People in the U.S. want to go to a hospital? No. Is it expensive? She's already closed her hospital. There's a lot of hospitals that are getting closed. All right, we have a lot of private hospitals, just like this one, but they don't have many more beds. We have veterans hospitals, and look at the number of ambulatory surgery facilities. Look at how many compared to hospitals, just as more ambulatory surgery or ambulatory care. So if you want to have your gallbladder removed, yeah, you have to go to a hospital? No, you go to the ambulatory care surgery. Go in the morning, come out in the afternoon, and go home. So last year, I needed my hip replaced. Right? I have arthritis. So I needed my hip replaced. Now, because I'm old, I had to go to the hospital. Right? I'm high risk. So I went in the morning, 8 o'clock, got ready for surgery, first hour, 9 o'clock I was in the operating room. Okay? 11 o'clock I came out of the operating room with my new hip. I went to the recovery room, hour and a half, went to the recovery room, went to my room in the hospital, and I was awake, and you know what I did? Got out of bed and started walking. Yep, got started walking. Went home the next day. Next day I was home. So less than 24 hours. We don't like hospitals. Yeah, I had a wound. No drain. Nothing. I don't know. Paracetamol. That's all I took. Okay? Where do you get the most infection in a wound? At home or in the hospital? No choice, right? And why would I have to change it? No dressing change. Evidence says do not change the dressing for 48 hours. That's evidence. Don't muck with the dressing. After 48 hours, I took a shower. Take a shower. Take dressing off, get wet. Evidence says better to have it uncovered than covered. Okay? We are very much evidence-based practice in the U.S. If there's no evidence, you don't do it. If there's evidence, you do it. That's one thing that Taiwan doesn't spend a lot of effort on, evidence. I am learning that. All right, so look at all the ambulatory surgery facilities. Look at all the ambulatory care. So if you have medical problems or surgical problems, you can go to the same place. All right, so ambulatory surgery centers, what are they? They are owned by doctors. Yeah, they're owned by doctors. You can do same-day surgery, so plastic surgery, dental surgery, gallbladder. Now they're doing knee replacements, same-day surgery. Any type of surgery that doesn't require much recovery. Eyes, eyes. Cataracts, in and out in an hour. In and out in an hour, yeah. So orthopedic pain clinics, my husband goes to this is my husband's ambulatory center. He goes for his back injections, plastic surgery, otolaryngology if you need anything to do with your mouth or your throat, ophthalmology. You can have procedures done here for OB or gynecology. You can have your colonoscopy. This is where you have your colonoscopy done, right? You don't need a hospital. And if you need dental work, so if you need like all your teeth taken out or you have an abscess, that's where you go. You don't go to a hospital. Now, what happens to the ambulatory surgery? You get there an hour before, You speak to an anesthesia provider. That provider may be a nurse, a certified registered nurse anesthetist. We have nurses who are trained in anesthesia and may be the only person giving you anesthesia. And guess what? They give you better care than the physician. I always want a nurse anesthetist. I never want a physician. Why? They pay better attention to you. So you get your surgical procedure with the anesthesia, you recover from anesthesia, you go home with an adult, must go home with an adult. After the nurse gives you instructions, they will call you 24 hours later to find out how you're doing, but it can't be for high-risk patients. It can't be for high-risk patients. So, what about long-term care? We have a lot of long-term care. A lot of our care is in a rehab hospital. So if you have a stroke, you will be in the hospital probably for 3 days. Only 3 days. And then you'll go to rehab. And you'll go to a special rehab hospital. The insurance will pay for 1 month for rehab. Right? And boy, do you work in a rehab hospital. Not the nurse, the patient. The patient works hard. 6 hours a day of rehab. Right? Now, if you cannot rehab within a month, you will go to a nursing home, long-term care. Assisted living is assisted nursing, but not complete nursing care home. So you have to be able to get up and move in assisted living. So as a result, what do you think our length of stay is in the U.S. in hospitals? What do you think the average length of stay is in a hospital in the U.S.? A week? About 3 to 4 days, length of stay. Okay. What is the length of stay in Taiwan? A week to a month, right? A week to a month. Yeah. Yeah. Why is our length of stay too low? We don't like hospitals, and they're expensive. 1 day in the hospital, medical surgical, is about 10,000 US dollars. That's what, 3 million US, 3 million SUD, right? Yeah. And that's just for nursing care. That's not for your drugs, it's not for your surgery. You get food and room and a bed. And that's all you get for that. All right, we have home health visiting nurses, right? So 10 years ago, I had my knee replaced, and because I had a complication of pulmonary emboli, I was on anticoagulant, so I had to visit. I went home in 22 hours after surgery during the OR, and so I had a visiting nurse come see me. And it was very fun because she was one of my former graduate nurses. I don't know how fun it was for her, but it was fun to me. A visiting nurse will cost about 100 to 150 US dollars per visit. It is covered by insurance. She made a post-operative visit to check how I was ambulating. She looked at my dressing, so all she did was look, checked my medications, was able to draw blood, check my blood pressure, and decided if I needed a home health aide. A home health aide is someone who comes in and helps you with the home, helps you prepare meals, cleaning, and that kind of thing. Okay? And if you need hospice care, a visiting nurse can provide hospice care only. So she came and checked my surroundings out and said, I am going to send a physical therapist. So I had a physical therapist come to see me for 2 weeks, 3 times a week. He made 6 visits to help me with my physical therapy after my knee replacement, to make sure I was moving well. Because the one thing after knee replacement is you have to be able to then look at that. All right, who else do we have for providers? Labs. We have a special lab. If I need to go get blood work, I don't go to the hospital, I go to the lab. If I need physical therapy, I go to the physical therapy business. If I need a chiropractor, I never go to a chiropractor, but you could go to a chiropractor if you like. I don't believe in chiropractor. And if I need a pharmacist, I go to my local pharmacist. Now, a local pharmacist cannot give you drugs that are prescribed. You have to go to that. All right, so here you go. Here's your decision. This is your problem right now. Your adult son wakes up in the morning with a bad cough and headache. You're going to be the son. This fellow ends up bad cough and headache. Can you cough a little bit? Do you have a headache? Yes. He complains he had a sore throat for 2 days. Yeah. You have a sore throat now? No. A little bit, okay. Don't overdo it. You took paracetamol for discomfort, right? Did it work? No, it didn't work. Right? Where are you going to go in the U.S. for health care? You're now visiting. Where do you think we're going to go? Well, the first choice is primary care physicians. Do you have a primary care physician in the U.S.? No. And there are no appointments available for 3 days. Can you wait for 3 days? No. No, you hurt too much, right? Yeah. You want to go to the hospital emergency room? No. The wait time is over 8 hours. And the insurance only pays for emergency care only. Is this an emergency? No. You've had it for how many days? 2 days. That's not an emergency, right? Where does he go? Ambulatory care. There you go. An ambulatory care facility is available in my town. You sign in, get seen within 15 minutes by a nurse practitioner. She takes a history, completes an assessment, looks in your throat, looks in your ears, gets a throat swab for testing. Within 5 minutes, the test is positive for strep. Yeah? What are the three symptoms of strep throat? You need to learn these before you graduate, folks. Strep throat, headache. Sore throat that goes away after 2 days. Okay? And feeling okay after 3 days. But you still have the strep. So, tested positive for strep, the ARNP, the nurse practitioner, gives you the first dose of antibiotic, PO, you can have a PO, and a prescription for a week. She tells him that he needs to rest, drink fluids, and take all of the antibiotic, even if you feel better. On the way home, he stops at a pharmacy to get his prescription filled. The pharmacist educates him about taking his antibiotic with meals. He returns home to rest. The next day, the nurse practitioner calls him to ask, how are you feeling? Are you feeling better? Oh, right, thumbs up. The ARNP will send a report to his primary care physician for his medical record. Had he gone in the emergency room, it would be at least $3,000. In the ambulatory care facility, $180 paid by your insurance. That's better health care. Yes? All right, healthcare in the U.S. So we have numerous types and locations of care. Consumer picks the best option. So you have to be an educated consumer as to where you go. You just don't go to the emergency room. You have to be educated. Do I call my PCP? Do I go to ambulatory care? Do I really need to go to the emergency room? Insurance companies limit the options. Primary care physicians are the gatekeepers of routine health care, not emergent or difficulty problems. Specialists are by referral only. I could not go to a doctor to get my hip replaced. I could not go to an orthopedic doctor directly. I went to my PCP and I said, I need my hip replaced. And he did an assessment. He says, yes, you do need your hip replaced. I'll give you a referral. Here's your note to go right to the orthopedist. Average hospital stay, 4.57 days. Joint replacement, 36 hours. Cardiac cath with stent, 24 hours. Appendectomy, 24 hours. Actually, after an appendectomy, you go home in 12 hours and it has to be broken. Gallbladder, 24 hours. All right, so let's look at our providers in the U.S. We have a lot of physicians, 2.5 per 1,000 population. Very similar to Taiwan. Taiwan is 2.17 per 1,000. So the doctor's about the same per population. We have 4.7 million nurses in the U.S., about 12 per 1,000. And look at Taiwan. Not only that, but all of these nurses are not practicing. Taiwan has had a serious nursing shortage. So I hope you all stay as nurses, because Taiwan needs you badly. 70% of our nurses in the U.S. work full-time, 11% part-time, and 8% per diem. You know what this means per diem? By the day. A lot of nurses will say, oh, I want to work today. Can I call you up? I want to work today in your hospital. Do you need a nurse? Oh, yes, come on in, right? I can work for diem any day I want. Now, let's look at nursing roles. Big difference than Taiwan. Nursing do not assist physicians in the U.S. We do not assist physicians. Physicians do not tell us what to do. We are independent of other healthcare decisions. We do preventative care, primary care, acute care, rehab, long-term care, hospice, and a whole bunch of other things. 11% of our nurses now are male, which has definitely increased. The mean age is about 46. But we have a problem that almost half are over 55. We are a very old population of nurses in the U.S. In Taiwan, the average age is only 36. Only 55% work in hospitals. The average salary per year, 2.3 million NT. Yeah, that's 3 times what you're going to make here in the U.S. in Taiwan. 3 times. Yep. And that's going up. During COVID, oh my gosh, my daughter is a nurse. And during COVID, she was a traveling nurse. And she would tell me that in 1 week, she would make 60,000 NT. Yeah. Because of COVID. Yeah. It's like, whoa, I never made that much money. But yeah, she made a lot of money during COVID. 60,000 NT a week, for 1 week. 3 shifts, 3 12-hour shifts. 36 hours. Pretty good, huh? Yeah, and she didn't have to pay to housing. She didn't have to pay for her apartment either. They paid her apartment. All right, education, the highest level, we have baccalaureates and above, about 70%. We do have a 2-year program, associate's degree program. All right, how do you get an education in the U.S.? You can go to a 2-year program, but if you're in a 2-year program, you only care for patients with predictable outcomes, meaning that you're working in long-term care, skilled care, or a physician office. Yes, we do have nurses in physicians' offices. The preferred degree, and if you want to come over to the U.S. to work, you have to have a bachelor's degree, 4 years, or 2 years after this, you can get a bachelor's degree with 2 more years. What do they include that you don't include an associate's degree? Leadership, research, and community health. This degree does not include those courses. Where can you work? Anywhere. Hospitals, managers, visiting nurse, you can work anywhere with a bachelor's degree. Master's degree, you have to have a bachelor's with 1 year experience and 1 year coursework. If you have a bachelor's in another field, so my daughter got her first bachelor's degree in athletic training. She learned how to put tape on ankles and knees for sports people, right? And then she went into the Navy for 8 years, and she came out of the Navy, and she said, "Oh, you're not going to believe me, but I want to be a nurse." I said, "But you're not going to get a bachelor's degree. You're going to go and get a master's degree." So because she had a bachelor's degree, she could go right into a master's program, get her master's, and get her license. So we call that direct entry master's. She's now working as a NICU nurse in Washington. For a master's degree, you can become a clinical nurse specialist. You focus on a patient population, or you can become a clinical nurse leader, focusing on unit-based quality practice. As I said, we're very interested in evidence-based practice. Or you can become an advanced registered nurse practitioner, a nurse practitioner, ARNP. So a lot of options. The purpose of a master's is to master a specific field. Master a specific field. All right, what do nurse practitioners do? Just about everything. They can work with a physician, or they can have their own office and independent practice. They can work in acute care. We have nurse practitioners in the critical care, psychiatric care, mother baby care, long-term care, wellness clinics, outpatient clinics, and of course ambulatory surgery, ambulatory care. So nurse practitioner can be independent in any area, just about. They diagnose, they write prescriptions, they can even write prescriptions for controlled substances, narcotics. They can order and interpret lab tests. They can adjust treatment plans, they make referrals, health counseling. Their responsibilities and patients depending on their specialty. So an OB nurse practitioner cannot work in emergency room. Okay? An emergency room practitioner, nurse practitioner, cannot work in psychiatry. Nurse midwives can do uncomplicated deliveries, either at home or in the hospital. They can deliver in the hospital all by themselves, with a mother, obviously. Right? Nurse anesthetists can provide total anesthesia. So they are really an interesting group as far as providing health care. So what is the workday of a staff nurse in a hospital? Most nurses work 12 hours workday, 3 days a week. So if you only work 3 days a week, how many days do you have for vacation? 4, right? What do you do 4 days? Have a vacation? You work 3, off 4. Or maybe you work Monday, Wednesday, Friday. Or maybe you work Monday, Tuesday, Wednesday. You're off Thursday, Friday, Saturday, Sunday, Monday, Tuesday, Wednesday, and you work Thursday, Friday, Saturday. You have a week off. You get report, you do bedside rounds. Report is at the bedside. Report is never in the room, in the nurse's station. It's always at the bedside. You then we'll have all the nurses meet at the nurses' station for a huddle. A huddle means we all talk about the important patients that we have on the unit, so that you will know if my patient is pretty bad, and I will know if your patient is a CPR patient. So everybody knows everything. It's a team on the unit. You complete your assessment and you prioritize care for 4 to 5 patients. We don't have patient loads of 8 patients or 15. You give all your medications, PO and IV. You are responsible for starting the IV. You actually poke patients to start the IV. You focus on pain, medication education, and discharge. It's all about discharge. What do I need to tell patients to get home? You do dressing changes if they're ordered. You ambulate. We have a rule in hospitals, F to F. F to F. Feet to floor. Feet to floor in 2 hours after surgery. Evidence says that you get up and walk within 2 hours, you have a lower risk for what? What happens if you stay in bed too long? What happens if you stay in bed too long? What do you get? Pneumonia. What else do you get? Your muscles, good, your muscles get poor. What else do you get? Your muscles get poor, what else happens? You can fall, right? What else? We have a big problem with it. Bed sores, right? Oh, you're right on target here. You get blood clots, right? Your blood clots in your legs? No, we have that problem in the U.S. a lot. You don't move that blood, it gets slow and sluggish. So F to F, feet to floor. We ambulate patients, even if they don't want to. Get up and walk. And of course we feed them, feedings. So that will be your shift. You get patients ready for discharge, and then you get more patients from the ER, the ICU, or PACU. So it's constantly moving. So you're very busy, but it's constantly moving. You also have to coordinate care. A doctor or a surgeon does not cover the patients. They don't care for the patients in the hospital. We have one doctor who is called the hospitalist. They're responsible for all the patients. You have to coordinate with respiratory, OT, physical therapy, social worker, discharge planner. You're the coordinator of care. And you get those patients out of the hospital, out of bed, out of the hospital. So, what do you think about healthcare in the U.S.? What do you think? What do you think? I have a lot of candy up here. That's okay. Who wants to use candy, and you gotta tell me what you learned. What do you think about healthcare in the U.S.? What do you think? What do you think? I think it's good. Okay, good. For a nurse, yes, it's quite good for a nurse. What do you think? You have more holidays, yeah? Yeah, you gotta work-life balance. What do you think? For good for food, money? Yeah. You have good care for our residents. You care well for our residents. Who else? What do you think? It's good? What's good? What do you like about it? What do you like about it? Huh? Yeah. It's holiday, isn't it? Yeah. Well, so I want to get rid of this because I don't want to take it home. U.S. healthcare. What questions do you have? If you have a question, you get a. Who's got questions? Do we have problems in the U.S.? Yeah, we have problems. A lot of people can't afford healthcare. We don't know what to do about that. We don't have government insurance other than Medicare that we've already paid in. What do you think? You're Chinese, right? Better? Short, yeah. Staff nurse working time is shorter. Do we take care of just as many patients as you do? Probably. But we move them fast. We move them fast now. Okay, yes.
I don't need to be ambulance certified. It is good, but it is considered patients more complicated.
No, because it doesn't have a bed. It doesn't have any bed. You can't stay there.
And how many years can they be
Ambulatory care? Probably about 10 years. Oh, yeah.
Yeah, I think
Yeah, it's a good idea. It was a combination between doctors and nurses. And because especially in emergency rooms, it's a way to relieve the emergency room from yeah. Emergency rooms want really sick patients, right? They don't like people with like him with a sore throat. You take up time, you take up energy. You're not very excited. You know, if you're working in the emergency room, you want blood, you want guts, you want CPR, you want ACLS, right? That's what you're there for. Is that where you go in the emergency room? No? You don't want to go there? Too excited, never excited. So what do you think about doing? Sure. Sure, why not? We need nurses too. We have a nursing program. So I think if you want to come, now the problem is if you go over to the U.S., you got to do a couple things. It'll take you about 6 months to get a license. You have to take the exam. And you have to do a TOEFL. That's what it is. Yeah? What do you think about that? U.S. healthcare. Good question. What do you think? What do you think? No questions? No. You want to come to the U.S.? Where would you like to go in the U.S.? Where? Florida, right? Go see your Disney World? New York? New York? Yeah. New York pays a lot more. Question? What do you think? Yeah, so I have more private time. So I have more work for you. The nice thing about Taiwan is the government pays for all your health care. The bad thing about Taiwan is the government pays for all your health care. Right? So, right. And do they want to go to the ambulatory care? If you start ambulatory care, now we did the same thing. All right? When we started ambulatory care, people said, "Why would I go to ambulatory care?" You know? But now, really. So, you can go to an ambulatory care that's public, or you can go to private. So when the ambulatory care started, the hospitals went, "Oh my, we are losing money. We will start our own ambulatory care." So they started their own ambulatory care. So the hospital was on one part of the city, and the ambulatory care was on the other part of the city. good even. I like the private better. Your pastor. Yeah.
They want the stock economy to keep this about Medicare.
Yeah.
They want.
Right, because I paid for Medicare. I've already paid for it. But why do they only pay 80%? Because when I paid for Medicare, it was way back, and they didn't pay as much money. And now prices have gone up. So the price for my hip replacement, how much do you think it costs for my hip replacement? How much money? $50,000 NT. So that's about what? 2 days. So 50,000 NT dollars is about 1,500 US dollars, right? Okay. I pay my bill is 120,000 US dollars. 120,000 US dollars. The hip itself, just the prosthesis, was 50,000 US dollars. And anesthesia, plus the operating room, plus the surgeon, plus the labs, plus the drugs, plus the x-ray. Right? How much did I pay? $18,000. $600. Yeah? Pretty good, huh? Pretty good. I thought that was a good. Questions? Question. Oh, who's got a question? What do you think about U.S. healthcare? But very different, isn't it? Very different. And what's those stories? Yeah. Yeah, very different. What do you think? You want to come to the U.S.? No? Okay. Yeah. No. No, there's no room. They closed at 8 o'clock. No beds. No beds. No nurses, no beds after 8 o'clock. Right? So after 8 o'clock and you're still sick, where do you go? Well, where do you go? You're still feeling bad. Where do you go? Sorry. Yeah. What do you think? Are you ready? I like this thing. What do you think? You want to come to the U.S.? Yeah? Okay. You're welcome. And you can go to ambulatory care as a foreign person too. Yeah. You go to ambulatory care. Yes. American people want you what? Interference with government? No, there's not much interference with government. Nothing that doesn't interfere in your health care. Choice is yours. The choice is yours. Now, do we have a lot of health promotion? Not much. Not much health promotion. We don't focus on health promotion enough. Do we have community nurses? No, we don't. We do not have community nurses. So the government feels that health care is your choice. Healthcare is your choice. Okay? Healthcare is not required, healthcare is your choice. What do you think? Would it come to the US?
No, I don't want to leave for
You don't want to leave your parents, right? I understand that. I understand that. But you think that healthcare is different?
Yes.
Very different, right? Right. Absolutely. You know where your parents go. What do you think? Well, yeah, you think. What do you think? Would you like to be a nurse in the US? Yeah. Be different. Will it be easier? I don't think it will be easier. I don't think it'll be easier, but I think you'll get paid better. And I think you will have more breakthroughs, you know, which is important. Yeah. What do you think? When it comes to the US? I'm recruiting today. No. Will you visit? Come visit? Oh. Yeah, traveling nurses. So traveling nurses work for 3 months. So let's say she has a hospital that needs, what kind of nursing do you want to do? What's your specialty?
I think I want to do, I don't have to be this one.
Okay, all right. Well, let's say you want to be a medical nurse. Do you need medical nurses in your hospital right now? Yes, you need. Are you willing to pay for a medical nurse? Yes, you are. So I am your agent. I contact her and I say, okay, I have a nurse for you. She's a very good nurse. And I will make arrangements for you to come work for her hospital for 3 months. I will pay you. She's going to pay me. I'm going to pay you for your apartment, your travel, and your moving, and your salary. And I will get you a license and your state. Okay? And you will work with her for 2 months. And you don't get a choice if you want to shift. But you'll work for that one. And then 3 months later, you can say, I don't want her anymore. So I'll let her go to this hospital, right? And she may be in New York. She may be in California. Yeah, California, right? For one. So I'll make an arrangement. You contact me, I'll make an arrangement with her. I do want to work with under agent. Yes. Yes.
And I work from
Yes. You hear that? She wants to work double. So yes, people do. People do that. So you could work for one hospital. You could work for one hospital 12 hours for 3 days, take 2 days off, work for another hospital, or work in long-term care or as a visiting nurse 1 day a week. Yes. The thing about the U.S. nurses is they can work part-time. Anybody can work part-time. Anybody can work per diem. There's no requirement for full-time. I think it's going to run out of money. I think the Taiwan nurse insurance system is the reason that nurses' salaries are so low. They are paying for care that is not needed. But until you change the policy up there, you're always going to have low salaries. I think you need to talk to everybody you can who's in government. You got to change that policy, or else nothing in Taiwan is going to change. And what's going to happen is, by the time you are 10 years from now, 10 years from now I'll be gone, right? I think I'll be gone. But I would bet that your shortage will be even worse if your system, your health insurance system is not changed. You can't have people stay in the hospital just because they fell and had a concussion. Now, a friend of mine down in MCKU sat in a chair, fell back, and hit her head. Okay? I was talking to her on Zoom, and I said, I haven't heard from you. What happened? Oh, I fell. Okay, so you hit your head. Well, I had to go to the hospital. Wait. Well, I had to have a CAT scan. A CAT scan? For what? CAT scan doesn't show concussion. Well, in case there was a bleed. In case there was a bleed, are you on anticoagulants? No. I said, there's nothing wrong with you. Well, I had to stay home from work for a whole week. Why? I don't know. And then she had to go back for another CAT scan. Now, is that a waste of money? It's huge. Let me tell you a bigger waste of money. A big waste of money. So did you know if you arrive at a hospital and have difficulty breathing or maybe a little gastric problem or a little chest pain, right? What is the first thing the hospital's going to do in the emergency room? Give you an EKG. No questions, no assessment, EKG. Okay? EKG in the U.S. costs $500. Right? What is the evidence about giving an EKG for difficulty breathing? None. What is the evidence giving the EKG for GI problems? None. What is the evidence for an EKG with chest pain? None until you do an assessment. So in the U.S., we always do assessments first before we order expensive tests. In Taiwan, everybody gets an EKG. Everybody gets a chest X-ray. Everybody gets a CAT scan. Everybody gets an MRI. Everybody gets a urinalysis. What's the evidence on urinalysis? They are non-diagnostic. Right? So that's my problem with the Taiwan health system. They're spending so much money on things that they don't need to spend money for if their doctors were a little smarter. That's my opinion. So you all want to go on break? Are you going on vacation? You're going home, right? Can I go?
Yes.
Please. Can I go? One more question. Okay. One more question. Who did not get a lecture? Who did not get a piece of candy? You got a piece? You got a piece? You got a piece? Who else wants? One more question. I'm not getting a question. Yeah. Oh, now there's a question. Lawsuits. She said, I think they do more tests because they don't want to be sued. We get sued in the U.S. all the time.
How about the mental health people if they are having a problem
Yep.
on the street?
Yep.
What do they do?
The police come
They come and then
and they can do two things. They can take them to a psychiatric hospital or they can take them to the emergency room. They go to the emergency.
pay.
Well, they don't have any money.
Yeah, I don't have money.
Right, but we can't turn them away. We have to give them care. We have to give them care. Doctors and nurses in the U.S., I can get sued as a nurse. I can be be sued as a nurse for failure to be a good nurse. And one of the things that I do right now is I go to court and testify for or against nurses. Okay? So if he didn't get good care because the nurse didn't tell you that you had to drink, okay? The nurse never told him, and so as a result of his antibiotic, he went into kidney failure. Whose fault is that? The nurse's fault. You say it's my fault because I didn't tell you. But you are going to sue me, the nurse. So people like me go to court as experts and testify for or against the nurse. And so we can remove their license. You can take their license away. And sue them or just not remove it. That's in the movies. You have to contact the lawyer yourself. Pursue. Yeah, you have to have an injury and you have to directly say my fault. Just because you fall down, it's not necessarily your fault. Unless the nurse didn't help you, or the nurse didn't assess your risk. If you had high risk, then it would be the nurse's fault if you got that. Yes, we do have violence. We have violence.
Yeah, how about it?
What does a nurse do? Well, every hospital has security guards, and for psychiatric facilities, they have the guards right there, right on the unit. If the nurse thinks the patient's going to be violent, she will call the guard will come immediately, and the nurse just leaves the room. Yeah. Oh, not in the U.S. Yeah, no, they do. They can actually arrest people. They do arrest people. Oh yes. Oh yes, yes. And in the emergency room, there is also always at least 2 or 3 security guards. Yeah, at least 2 or 3. Yeah, and if the doctor gets mad at you and starts going, what do? Call security. Right. And what will happen is that doctor will get in trouble. And he may get booted out of the hospital. We have no tolerance. Zero tolerance for violence against nurses or harassment or bullying. Absolutely no tolerance. Okay. Any other questions? Another state. Yes. So in the U.S. we have 50 states and there are 50 different boards of nursing. But you only take one exam to cover every state. Now, about 75% of the states will allow you to transfer your license to another state automatically. So if you are in, let's say you're in New Hampshire and you don't like the snow, cold winter, you can go down to Florida for 3 months without getting another license and practice in Florida as long as you come back to New Hampshire. Yeah. Just for 3 months. After 3 months, you have to get a Florida license. Yes, you need to get a Florida license. No, never test again, right? Just apply. Just give them money. No, you never test again.
So how about we get the license?
For good, for life.
Forever. The license is forever.
Yeah, license is forever. Except in the U.S., you have to have practice and you have to have education, continued education.
Similar to
Yes,
Taiwan.
yes. So when I come to Taiwan, that's my practice. But I'm retired.
Yeah, yourself is that the job is continuing as
Computer education, yeah. Yeah, it goes the same. Anyway. How many times can you take your exam?
one day.
How many times? If you fail, how many times?
No limitation. No limitation.
Yeah, ours is national too.
And
So you fail, what happens?
test again.
You test again how many times?
No, no limitation.
No limitation. Every state has a different limitation.
Oh,
5 or 3 times per year in Taiwan.
You have to wait 6 months in the US
Yeah.
to retake. But you can take, in New Hampshire, you can take it 3 times. In Arkansas, you can take it as many times as you want. So that's been time and money, right? But if you fail it twice, you have to then provide documentation that you have gotten help. Remediation.
who can have?
Anybody, any education program.
Oh, good. Okay, any questions? I think anyone has many questions if they want to work in US. Yeah. But you can try how to know how to answer your question. And today we want to thank Professor Susan gave us a lot of medical assistants and nurse in the US, and we give her a try.
Thank you. So I will be in Taiwan for another 2 weeks. You know where my office is, right? Third floor? Third floor? So come up. If you're up there, stop in and say hello.
在现场办公室，他就说了呢，然后你们可以跟他聊天，了解任何你们想知道的任何问题，你都可以。
And remember, Taiwan needs you, right? So graduate and work.
Yes.
Work is a nurse. It's a very good profession. And if you don't like what you're doing, find another job because there are plenty of jobs, right? Always be happy. Always be happy. If you don't like, when I started out nursing, I was in ICU. And then I said, I need to make more money. So I went back to school. And I went back to school, I became a cardiac nurse. And I found another job. And then I didn't like that job after 3 years. And I found another job, different state. And I really liked that job, except it got boring. So I found another job. So there's plenty of opportunities out there for you. If you don't like what you're doing, find something that you like to do. Because if you're happy, you'll give better patient care. Right?
Yeah, it's good.
Right? If you're happy, you'll give better patient care. So there's many opportunities out there, especially in Taiwan, you have hospitals everywhere. Right? You have hospitals everywhere. So be your own boss. Be your own boss. Right?
Just think about it.
Direct your own future.
Be your own boss.
Be your own boss. How do you translate that? Can you translate that? Say it louder.
This is the 觉得我们很多